Thank you for joining today to learn more about the Digital Health Learning Program. My name is Angela Jonsson, Senior Director of Stakeholder Engagement and leading the Digital Health Learning Program.
Hello, everyone. My name is Haley Armstrong, Senior Specialist of Engagement at Infoway, also helping with the development and execution of the Digital Health Learning Program.
Hi, everyone. My name is Cindy Lapeña. I'm a patient partner, author, artist, editor, and teacher.
Great. And on behalf of Infoway, we'd like to thank you for taking time to attend our December Partnership Conference and this specific session, focusing on the Digital Health Learning Program. The work of this program aims to improve the digital health literacy levels of patients, families, caregivers, and Canadians, ultimately driving forward a population better equipped to access the same degree of care during the national shift to predominantly virtual care, an increase in healthcare system satisfaction and efficiency, and stronger collaboration between patients, families, caregivers, and their providers. The program is now live on the Infoway website, where you can access our materials covering topics of virtual care, health data security, access and privacy, and proactive health management in the form of articles, Q&As, checklists, and infographics. And before we go too much further into the program, Cindy, I want to know how you felt about digital healthcare before the pandemic. Was this digital transformation a welcome change for you, or did you feel concerned or a bit nervous?
Before the pandemic, it wasn't really such a bad thing because I could always default to WebMD or the Mayo Clinic websites. What was sad was that the Health PEI website didn't have all the information I wanted. So if I couldn't get it online and I couldn't get it from my doctor, I'd be a little lost. But since the pandemic started, my doctor started doing follow-up calls for any blood tests or any other tests I have. And she would check up on me every now and then. So that was really nice, but it was limited to phone calls. So I still wish we had a little more.
Fantastic. And thank you for that relatable perspective, Cindy. I think as we shifted into the pandemic, navigating and trying to find information was definitely an area of focus. And I know even personally, I was concerned for my dad, who still had a landline home phone, and I wasn't sure really about his ability to adapt to the digital change. But I was actually quite impressed because once he had the tools and the know-how and was able to kind of receive that information, he now actually prefers emailing his doctors or having check-ins on his tablet. And he's even telling me about new ways to connect, which is great. And I think this also is a great reminder in the importance of the materials being provided to individuals who need them most. When we were building this program, I think we all first acknowledged that not all Canadians are starting at the same digital health literacy level. And those communities with lower access to information, and services needed to be prioritized. Because of this, we've worked with individuals and organizations from all across the country, representing communities of diverse backgrounds who support marginalized and vulnerable populations, minority populations, new immigrants to Canada, mature adults and seniors, and others to really help drive and validate our work. And I think we would all agree that it was really these perspectives, insights, and overall guidance which helped us better understand the literacy topics most needed for our first launch of the program. I'm curious, though, to hear from you, Cindy. Who of your loved ones do you think this program would help the most? And as an activated and very knowledgeable patient partner, do you also feel the program helps yourself?
Well, I really don't have any immediate family on PEI. My son, however, is in Halifax, so I'm sure he will benefit from some of it, but he's pretty young and not yet concerned about health, right? So it's mostly really for myself, but not just for me, because there are people all over PEI who don't have the same access to healthcare that I do, or even to the internet that I do, especially in the rural areas. PEI is largely rural. About 3/4 of the population lives in a rural area. So I really think that sharing this with those communities and being able to reach them through at least some kind of resource that can be offered through the internet would be really helpful.
Yeah, that's really great, Cindy. I mean, I think you call out some really important individuals and communities who we should continue to be prioritizing and shaping and receiving a lot of these materials that are currently on our site. And I also want to make mention of the importance of collaborating with the communities who these individuals look to for trusted information, and organizations who are firmly rooted in their respective communities. We understood for this program to truly make a difference in Canadians' lives, we needed to not only create easy to use and understand materials, but these materials needed to come from sources that Canadians trust. And it is through the support of organizations like Patient Voices BC, the Arab Institute of Canada, and so many more that we've been able to reach out to individuals who need this information the most, and hopefully take another step towards equitably raising the digital health literacy level across the country. And in addition to these amazing collaboration and community organizations, as you can see on the screen, we've also executed a robust international and national environmental scan, a localized needs assessment and opportunity analysis, and ensured patient collaboration and validation every step of the way. From working tables, focus groups, one-on-one interviews, and more, we have worked with a range of diverse Canadians across the country to guide and validate each phase and output of the program. An advisory committee was also formed to holistically direct and shape this program, with participants coming from across Canada, identifying as either a patient, caregiver, or clinician. And now, Cindy, you were a valued member and still are a valued member of this advisory committee. So what has been your experience in helping to shape this program through the committee?
Well, as a member of the advisory committee, I really appreciated the fact that you guys at Infoway involved everybody and from such a wide or diverse range of backgrounds. And I really loved working with the group and hearing other opinions and other experiences and hearing what was going on, as well as learning more about what I could access or what I could share with other people, right? And it was fun because there were activities like consultations. I really liked the cloud forming, the word clouds. That was a really neat exercise, seeing the ideas popping up all of, as we were entering them. And of course, looking at the different posters and material that would help and that would be disseminated or launched among other communities so that everybody could access the same information. So I really appreciated that.
Amazing. Thank you, Cindy. And I echo Angela, and I think the full team's appreciation for all of your feedback and engagement throughout, whether it's the advisory committee meetings or focus groups, or even just shooting you an email to get your opinion. It's been unbelievably appreciated and has truly helped us develop and guide the program. I also want to thank all of our other patients, families, caregivers, and Canadians who helped transform the program into what it is today. We really couldn't be where we are and have reached all the provinces and territories, communities and individuals that we have so far without your support, insight, and experiences guiding us. So thank you. If you'd like to become a patient partner or explore becoming a valued member of Infoway's community, we'd be more than happy to connect. You can do so by reaching out to myself. My contact details are available on the engagement hub on the right-hand side of your screen. We look forward to staying in touch and are excited to hopefully have you join us in this work.
That's great. And in addition to being able to access the program materials on the Infoway website, we've also developed a toolkit to help the support of the sharing of this program and the dissemination through organizations. So if you are interested in getting the toolkit, using the toolkit for your community or organization, please reach out to Haley Armstrong. Her contact details will remain on the Engagement Hub on the right-hand side of your screen. So if you are interested, please do not hesitate to reach out. And, thank you again for tuning into our session today. Thank you to Cindy and Haley as well. Today's session was wonderful, and I really hope that you enjoyed the remainder of today. And I will now pause for any questions from the audience.